As many of us know, and we've heard over the last couple of days, we are at a near crisis in staffing in the senior living industry. All of us experience the same difficulties: changing regulations, competitive pay, fight for 15. We build in affluent areas that don't have an applicant pool, and there is a degree of burnout amongst our staff. We're also challenged with retention. There's a supply and demand issue. We have more seniors coming into the marketplace with fewer people to take care of them. 60% of healthcare workers say they're burned out in their jobs due to doing more with less. Residents are harder to care for. They're coming to us with higher acuity, many complex needs, and the teams are telling us these residents are harder than they used to be. There's also increased competition. Argentum tells us we need 1.2 million workers by 2025. I've heard that number be as high as 2.3 million. And CNBC said there will be a 41% increase in the need for home health aides. The bottom line is recruitment and turnover is expensive. The average 200 resident community spends between $800,000 and $1.3 million per year in turnover. That number is staggering. It costs approximately $2,500 to replace one frontline worker and up to $5,000 to replace one experienced nurse. Lots go into those recruiting expenses. The untold cost is loss of productivity and quality of care to the residents. That's what's most important to most of us. At Benchmark, we believe in the power of human connection to transform lives. Historically, our turnover has been 45%, which is high but good for the industry. Over the years, we've tried many different things to reduce that turnover, and we've been successful. We've implemented technologies. We've changed our onboarding processes. We've increased training for the frontline staff. We've increased training for the hiring managers and leaders. We've changed regional team support to give more support to the communities. All of that works. We survey a new employee 5 times a year to ask them how we're doing. What is it like to be an employee in one of our communities? What could we do better? We constantly ask ourselves, what else could we do? And we try to imagine a different way. What if we could increase retention? What if we could increase resident satisfaction? What if we could put the right person in the right job and have them be more successful? How could we increase the efficiency and the effectiveness of hiring managers? And then we were introduced to Arena. We were told that Arena reduced their acute care partners' turnover by up to 34%, and their assisted living partners up to 28%. We thought, let's try it. This seems to be a no-brainer for us. The way that Arena works is they use big data, artificial intelligence, through the application process. So an applicant gives us a resume and an application online. That data, along with third-party data from social media, from places like Glassdoor, tells a story about the applicant. We then ask them to take an online assessment. They can take it on a tablet in our community. They can take it on their mobile device, or they could take it in the comfort of their own home, whatever they choose. They take a very simple questionnaire. The results of that questionnaire, the data that was collected, goes through an algorithm, and Arena makes a hiring prediction. The person is highly likely to stay employed by you, they're unlikely to be retained, or a neutral score. Those are fed back to our hiring managers so they know who to spend time with during the interview process. As time goes on, that algorithm becomes more customized to the community and to the position. The workflow looks something like this. There's an integration with our applicant tracking system with the Arena software. The applicant takes the online questionnaire, and the hiring manager receives an email telling us what their score or their likelihood to be retained is. We decided to focus on high turnover, high volume positions that were resident facing, those that are most critical. So we are screening nurses, resident care associates, activities professionals, housekeeping, front desk, sales, those critical positions that touch the residents. Very simple process. At Benchmark, you take an online application. You then will take the ARENA questionnaire online. ARENA generates a retention prediction. We use that prediction to identify who to interview. We interview and we make a hiring decision. Very simple. The questionnaire is the most interesting piece. It's a list of personal preference questions. There are no right or wrong answers. There are time sections with math and reading. That instills some commotion in the applicant. ARENA is behind the scenes watching their behaviors. Are they skipping questions? Are they moving through the questionnaire? What are they doing with their mouse clicks? So it's not a right or wrong situation. We've only had this implemented for 4 months. Early results are positive. We've hired 140 high retention predictions. We've decreased our turnover in those roles by 30% so far, compared to weak retention predictions. We have forced our community's teams to use technology, which they're not used to. And the most important thing is that hiring managers are saying, you know what, I'm seeing better quality people, I'm spending less time in recruitment, and those people that I interview are much better than they used to be. Keys to success. We needed leadership's buy-in from the top down. We needed operation support to get the community teams to operationalize this. In addition, we needed great IT support. There's a lot of systems that need to be integrated, so our HRIS, our ATS, and the ARENA platform. We also established a champion user group out in the communities. These are our super users that are telling us how the process is going, and they're promoting the ROI at the community level. And the ARENA team is amazing. I do a weekly check-in and status call with them, and we have some strategy calls slated for the future. Some things that we're going to look at to see if we have a good return on our investment: increased tenure, resident satisfaction increase, associate engagement. Are those people more engaged than other employees? Is it a safer workplace now? Are there fewer time and attendance issues than we saw previously? Sales. In a community where we've hired multiple high retention prediction applicants, are sales in that community better than in other communities? We'll look at other quality metrics to determine if this is working. And then career paths. Are those high prediction associates moving through the organization and becoming high potential employees for us?